Hi all, myself Beno Paul from the SNS College of Physiotherapy. Today we can see about the leprosy. So what is leprosy and what are the epidemiology, what are the causes, what are the types of leprosy and clinical features, investigation and treatment. Today with this topic will be discussed about the leprosy. So leprosy it's mainly due to the any communicable agents or microbial organs that we affected. So mainly leprosy is also called the Hansen disease, and also this is an infective disease so caused by the Mycobacterium leprae, and it's primarily affect the skin. So first primarily affected skin, peripheral nerves and upper respiratory. Secondary we can involve the any organs. So this is a leprosy. So types and classification of leprosy. So we have a three types: passibulatory leprosy, multibacillary leprosy, and Ridley Jubbling system. So in passibulatory leprosy, we have 1 to 5 skin lesions. So there is a no bacilli detected in the skin smear, and also mild form or easily to treat these type of the leprosy. And second we can see about the multibacillary leprosy. So this is more than 5 skin lesions are involved in these type of leprosy, and also nerves also involved. So the bacilli present in the skin smear, and also more severe, and also treatment will be longer than the PB leprosy. And third type, so Ridley Jubilee system. So in this detailly mainly immunologically spectrum. So included that's a TB also involved in leprosies. So mainly advanced classification these third type. So these three types of leprosy we have in most common in the India also. So in globally epidemiology, we can say about leprosy, approximately 2 lakh new cases are seen in each year. So based on the 2023 data, so this disease mainly endemic in overall 120 countries. So in higher prevalence in the India, Brazil and Indonesia also. So we have 95 percentage of populations we can naturally immunized to the this Mycobacterium leprae. So incubation period for this leprosy. So typical duration mostly 3 to 10 years we can incubate these viruses. So we have slow growth of the bacteria, and a extreme range due to for few weeks to the 20 to 30 years. So this incubation is rarely cases we can see, and form specific onset incubation. So this is a tuberculoid symptoms typically appears in 4 years, and lepromatous around 8 years. We can see this type of leprosy. So mode of transmission, the leprosy mainly droplet spread and prolonged close contact and non-infected after treatment and no causal transmission. So in droplets spread through the nasal or oral droplet from the untreated person or untreated leprosy patients. Like multibacillary leprosy easily transmitted to the nasal and oral droplet, and prolonged close contact so required extensive sustained contact, not casual interaction like shaking or handshakings. And third transmission is non-infectious after treatment. So patient became non-contagious rapidly, only multi-drug therapy begins, and no casual transmission, so not spread through the sexual contact from the mother to the fetus or brief informations. So clinical features, so mainly leprosy clinic primarily affected the skin and the peripheral nerves. So skin lesions like hypopigment or reddish patches present in the skin, and also we have loss of sensation, that is a touch, temperature and pain. And peripheral nerve involvement we can leads to thickened nerve, so that can notice by in the elbow, wrist and ankle. So these can be progressed in the numbness or any muscle weakness and or any paralysis also involved. And sensory losses like numbness also presented in the leprosy. And eye complication you can see a severe or mild, so moderate to severe vision loss, that's the inflammation present in the eye. And corneal ulcers also present. So diagnosis and investigation, we can see about the cardinal features like skin lesions and peripheral lesions and sensory loss and thickening nerves. We can easily diagnose with the cardinal signs. And also skin biopsy, we can do histopathological examination that acid fast bacilli is positive in these disease. And also we can differentiate with the classification of the leprosy. So treatments we have only done by the multi-drug therapy. So we have a core medication and treatment duration and efficacy. So mainly these multi-drug therapy done by the WHO, that is a World Health Organization. So core medications we can like dapsone and rifamycin and clofazimine. And treatment duration in passive cases treatment lasts for 8 months, and multibacillary cases we can duration extend to the 12 months. So these are the treatment duration. So today we can see about that leprosies and what are types. So we can discuss about the summary. Thank you.